colleague, Mr. Smith, from New Jersey, who I've learned a great deal from, primarily about being passionate for those who are least among us, for being passionate in the belief that women deserve better than abortion. So I thank you for your leadership, sir. I'd like to point out what is becoming increasingly clear, Madam Speaker, that the health care plan under consideration would authorize federal funding for elective abortion, even though the majority of Americans do not want their government funding that procedure. Several amendments, as has been discussed, introduced in the committees of jurisdiction to make sure abortion funding was explicitly excluded from the bill, all failed. Now it is reported that there is a so-called abortion funding compromise that I fear is put in place to draw the support of pro-life House members who otherwise in good conscience would not vote for this particular bill. This move should not mislead the American people. However cleverly worded the proposal might be, this plan would authorize a government-run option to fund elective abortion and subsidize private plans that cover elected abortion. This language creates a smokescreen by appearing to offer a restriction on the use of federal funds for abortion while leaving in place the key legal authority which says, quote, nothing in this act should be interpreted to, again, quote, to prevent the health insurance option from providing for coverage of elective abortion. The abortion language requires the public option to hire contractors to ensure that money paid into the government option could potentially be used to pay for elective abortions. For example, Medicare contracts with private business to handle claims, but no one in their right mind would say that Medicare payments are private payments. They are government payments. So this new compromise language is a hoax. So, Madam Speaker, I don't believe my colleagues should be misled. I also believe that we should have the opportunity for more dialogue and debate and consideration of potential amendments that could actually strengthen the opportunity for good health care reform in this country. I would personally like to offer an amendment that broadens a long-held American tradition that we call freedom of conscience, and I'd like to simply read a part of the amendment that I will potentially offer. It says the federal government and any state or local government or health care entity that receives federal health assistance shall not subject a health care entity to discrimination on the basis that the entity does not perform, participate in, or cover specific surgical or medical procedures or services or prescribe specific pharmaceuticals in violation of the moral or ethical or religious beliefs of such entities. This amendment goes on and actually protects the freedom of conscience of those who are actually in the health insurance coverage business by saying that the federal government, any state or local government that receives federal health assistance shall not prevent the development, marketing, or offering of health insurance coverage or a health benefit plan which does not cover specific surgical or medical procedures or services or specific pharmaceuticals to which the issuer of the coverage or sponsor of the plan has an objection of conscience that is clearly articulated in its corporate or organizational policy. So, Madam Speaker, here's the issue. We should be allowed to amend this bill. We should be trying to work together to strengthen health care for all of Americans by improving health care outcomes, reducing costs, and protecting our most vulnerable. The most vulnerable include people who find themselves in very difficult circumstances, those who call upon us, maybe not verbally because they're inside the womb, but those who are the least among us that need our protection and help. So with that, I yield back to my colleague, Chris Smith. Thank you.
I thank my good friend then for his very strong statement. I'd like to yield to my good friend and colleague, Dr. Rowe.